several different acts pertaining to water. Now, not all of these are directly related to drinking water, but most of them intersect with drinking water to some extent. Safe Drinking Water Act is our primary act related to drinking water. And this is put in force by the EPA, regulated by the national level EPA. We have the Clean Water Act, and this is where the national EPA has asked states to create standards for their surface waters that are going to be used for drinking water. And also seeks to reduce pollution that might be released into these waters. CERCLA, you might have heard of this, it's more commonly known as Superfund. That is our funding that cleans up our toxic waste sites across the US. So obviously anything that is in the ground could potentially get into our surface and groundwaters. And RCRA, our Resource Conservation Recovery Act. These two acts regulate hazardous waste, which again, we don't want to come into contact with water. And then we have FIFRA, this is a big alphabet soup. This is very typical for government. Our Federal Insecticide, Fungicide, and Rodenticide Act and the Food Protection Act. These regulate pesticides. And pesticides can also enter our water through surface water runoff and groundwater infiltration. So these are sort of national level regulations, right? But I do want to point out that there are some exceptions. This is from the EPA website, and it does note that Congress did create an exemption for hydraulic fracturing, also known as fracking, under the Safe Drinking Water Act. So unless fracking is using diesel fuel, it is not considered underground injection and is not subject to regulation under the Safe Drinking Water Act and the Underground Injection Control Program. So that's something to keep in mind. There are not many exceptions, but this is one that I think is notable. And it is on the EPA's site. So what about state level regulations? We have national regulations. What about the state? States can choose to have more stringent drinking water regulations than the national government. It's really not typical. Very few states do. If you had to guess which state, you'd be correct if you said California. California, I want to say in around 2000 and late 2000, what do you call those single digits? Single digits of the early 2000s, before you got to 2010, they had some issues with drinking water in a town where it met all of the Safe Drinking Water Act provisions, but if you looked at the water, and if you tasted the water, it looked pretty gross, and I guess it didn't taste very good either. So California passed legislation requiring that providers create potable and safe and sort of palatable drinking water. So California, again, they're unusual in that regard. And it'll be interesting to see if other states follow suit with that. So in short, though, it's really not common to happen. Okay? And the Safe Drinking Water Act does enable states to do this. It says yes, states, local governments, they can do this. So states do, however, have their own surface and groundwater withdrawal regulations, and this is just to give you an example. Ohio, this is all from a pretty handy website, the National Council for State Legislatures. Ohio, withdrawals of 100,000 gallons per day must register with the state. So the state's simply keeping track of the fact that they're withdrawing 100,000 or more gallons per day. Certain areas that are considered water stressed, you must also register. If you are withdrawing more than 2 million gallons per day over a 30-day period, you also need a permit and you have to report your withdrawals. So that's another level. And I just wanted to contrast that with Pennsylvania, which I thought was interesting, doesn't have any comprehensive groundwater and surface water regulations for withdrawal. Okay, so that's very different. And again, 50 states, 50 different requirements regarding this. So it can get complex. So I thought this was a simple little chart to show you the government of the United States. So this is the national level, and just to give you an idea where the EPA fits in all of this, we have our legislative branch, right, our executive branch, our judicial branch. The executive branch, well, first of all, Congress, as you know, makes the laws. They create legislation. Who takes those laws and enforces them? The executive branch does. How does that enforcement work? Well, the executive agencies, after the legislation is passed, must create rules, a way to achieve this legislation. So the legislation is not always super specific. In fact, politicians prefer sometimes that it not be too specific, because that can get touchy, right? So they kind of gloss over that sometimes, and the agencies are left with, okay, how do we enforce this? How do we create rules? And so this gives you an idea. These are all of the executive agencies directly under the executive branch, and then we have some independent agencies, and the EPA fits under this. Okay, there's not a slide large enough that could then show you also the branches off of the EPA, all of the different offices under the EPA, the various different regions in the US, and that sort of thing. The national EPA often works in concert with the state environmental agencies, so in Ohio, that's the Ohio EPA, to regulate and to enforce. So big picture, the Safe Drinking Water Act. Two things that the EPA does under this, two big things, I guess. They identify contaminants from something called a CCL, Contaminant Candidate List. They identify at least 5 every few years, and the list is updated every 5 years. And they develop regulation regarding that, okay? Any that they identify that should be regulated, they single out, and then they have to create rules on that. They do not always create new rules every 5 years, however. So currently there's a list, and I think I have another slide with that, of about 91 different substances that are regulated, and that hasn't been changed since about, at least substantially changed since about 2000. So this, after they identify these, they develop regulations, if any are deemed to be harmful. They identify a maximum contaminant level goal and then a maximum contaminant level, and that's the enforceable piece. So often you may see that this MCLG is actually 0, nothing, but that's often not attainable or measurable, so this is the enforceable goal. Every 6 years, the EPA reviews the regulations to make sure that they protect public health, because in our modern era, we're always creating new chemicals, we're doing new studies, we're finding out, oh, this chemical that's on this list that we thought wasn't really an issue, we have new scientific evidence suggesting that maybe it is an issue. And that's what this 6-year review enables the EPA to do, to take substances that maybe weren't an issue before and say, okay, they are, because it's not protecting public health the way that we thought it would. This act, it's important to point out, does not cover private wells for households. Okay, none of the regulation covers that. So if you have your own private well, you are responsible for testing your water. And of course, it does not cover any contaminants that are not on the list. And that's an important point. And that's something that, that's where it can get pretty heated and political. How do you get on the list? Should you be on the list? And this type of thing. So current substances regulated, this adds up to about 91 or so. 7 microorganisms, 4 disinfection byproducts, 3 disinfectants, 16 inorganic chemicals, 53 organic chemicals, and 4 radionuclides. So quite a few things regulated that need to be tested for by your local water provider. By the way, local water providers are sometimes private entities, Aqua Ohio, for example. Other times they're public entities. And I am going to point out, we have Mr. Dean Reynolds here today, and he is Alliance's water superintendent. Dr. Dean Reynolds, I will point out, yes. And I was able to talk to him yesterday, as was Jeff Booth, and he pointed out in terms of testing, so there's the issue of the water when it leaves the establishment, and then the water at the end of your tap. And the lead issue is an issue in the pipes. So it's not an issue leaving the water treatment facility. That testing, so houses are tested, I think you said every 3 years, 30 houses. End of the tap tests are done in houses, okay? So you do have feedback on that. But, and I'm hoping at the end that he'll be willing to take some questions if anyone has any. But I've also had the pleasure of touring that facility many times with my classes. And if you haven't taken a tour, I highly recommend it. It's a very impressive tour. And most people, we tend not to know about our water or really think about it and take it for granted, and you won't take it for granted. And I believe he also did you bring some of the coding by any chance?
I was just telling my assistant that I forgot.
Oh, yeah, okay.
But, you know, I think I can describe it so people can picture it.
Yes, I think so. That would be great. So future substance regulation, this is the list that we were talking about. Currently, that list is due to be released in 2016. They're working on the 4th version of it. And this is where you can find the chemical and the microbial substances currently under consideration for the 4th iteration of this list. And I kind of already discussed this, but many state regulatory bodies do serve as the national EPA sort of arm in terms of state enforcement. So another question people often have is then who tests the water? You know, the national level EPA doesn't come into your house normally. They don't normally go into water treatment plants all over the country and test water. They can, and they do, but most of it is self-reporting by the water treatment facilities, and that's where most of the data comes from, okay? Additional information, I would recommend this database, and certainly this article on drinking water. It's a little bit dated, but it provides some insight into substances that are not regulated in our drinking water. Maybe they should be. So in other words, your water may be meeting all of the Safe Drinking Water Act standards, but some suggest that there could still be issues with it. And this is, again, California, one of the water treatment managers is featured heavily in that article, and ways that they've tried to make their water cleaner, even though it does meet all of those standards, they feel that there's still some issues there. So, and we can also show any of these sites if you wanted to see them, but with that, we'll open it up to questions that you might have.